Welcome sir to my page, and as we all know that we are starting the questionnaires with Dr. Jaiswal sir. He is a renowned physician, and without any further wasting our time, we will start with the questions. Sir, the first question I want to ask on the behalf of all the beginners, all the homeopaths who are approaching the practice, how do you think they should go and they should start practicing?
I would like to share some of my derivations with the beginners. Always insist for pre-case taking preparation. Always educate your patient in regards to importance of symptoms in homeopathy. Explain them. The better the history given by the patient, the better would be the treatment. And this kind of briefing, this kind of educating the patient will make him more sincere, more cooperative and more accountable. Another thing I would like to say, do not ignore the sources other than the patient. See, majority of our patients are accompanied either by wife, husband, maybe son, daughter, maybe some other family members, maybe friends, relatives. And many a times we forget asking accompanying person in regards to the behavior of the patient. I would share one of my examples. There was a patient who came for the treatment of dry coughing, and he gave a very nice history, including exciting cause. He gave sensation, modalities. But then I was confused between two drugs, spongia and aconite. And I still remember his mother said, I have seen him holding the throat while coughing. Now this particular symptom was not given by the patient. It was given by a source other than the patient, and it helped me in the selection of aconite. Another thing I would like to say, do not accept the symptom at its face value. See, there are many patients, they give you the informations which are not reliable. A patient would say, he is better by sitting. And he would say, my respiratory complaints are better in this particular position. I remember one of my patients, I asked him, will you please show me the position? And when he showed the position, it was knee chest position. Just imagine, if I would have selected a remedy on modality given by him, my prescription would have been deceptive. Another thing, do not get mesmerized by diagnostic terminologies written in the files. Even these terminologies are used by the patient. Remember, we are not treating MND. We are treating a person suffering from MND. And this basic concept should never be ignored. Many a times, our success will make us prejudiced. A homeopath would have given Berberis vulgaris successfully in lot many patients for left-sided renal calculi. So he is prejudiced. In one of his patients, Nux vomica might be clearly indicated, but he is so prejudiced, instead of giving Nux vomica, he would give Berberis vulgaris. So he is prejudiced because of his own success. Similarly, you might have given a wrong drug. Say for example, graphitis must have been given wrong to a patient having skin disease. And this graphitis would have created undesired, unwanted medicinal aggravation. And now you are so scared of giving graphitis. In another patient, all symptoms of graphitis are there. It's an indicated remedy. It is homeopathic to the case. But you are so scared because of your failure. So always respect the law of similia. Don't get prejudiced by your success as well as the failure. Another thing, do not try to see zebra in the middle of Vadodara city. Meaning, don't emphasize more on rare remedies. You should always try to master the polycrase remedies. Don't use rare remedies because they are attractive. The names are unknown to the people and you want to establish your identity. Polycrase remedies are those remedies which are often required and they are very useful and they are result oriented. And last thing I would like to tell the beginners, always try to create your own materia medica, and this is going to help you a lot.
Thank you, sir.